In this video, we're going to talk about something that could change the way you approach your healthcare as you get older. I'm Dr. Linda Parker, and today I'm going to share with you the truth about 3 common medical tests that many doctors insist you need after age 70. But here's the thing, research is showing that these tests may actually do more harm than good for healthy seniors. In fact, they can lead to unnecessary complications and even shorten your life. It's time to take a closer look at these so-called mandatory tests and understand whether they're really necessary for you. If you're over 70 and you've been told you need these tests, or if you're caring for an elderly loved one, this information could literally save your life or theirs. Stay with me, because by the end of this video, you'll have the facts you need to make informed decisions about your health, and avoid unnecessary procedures that could be putting you at risk. Before we start, I'd love to know, where are you watching from today? Just drop your state or city in the comments below. It helps us feel like one community here, learning together and supporting one another. And if you have any natural health tips of your own, feel free to share those too. Someone else might really benefit from hearing what's worked for you. Test 1, colonoscopy after age 75. Let's start with a test that's probably one of the most common ones doctors recommend: colonoscopy screening. If you're over 75, your doctor might still insist that you get one, even if you feel perfectly fine. But here's the truth, routine colonoscopy screening after age 75 may actually do more harm than good. Medical studies have shown that colon cancer grows slowly. So, if you had a normal colonoscopy at 65, the chances of developing any dangerous polyps in the next 10 years are very low. The risks of the procedure, however, increase significantly as you age. Seniors face a much higher chance of complications like bowel perforation. That's when a hole forms in your bowel during the procedure. For older adults, this happens in 1 in 300 procedures, compared to 1 in 1,000 for younger patients. The bowel prep itself is another concern. It can cause dehydration and electrolyte imbalances, which might lead to heart problems or even a dangerous fall. And let's not forget about the anesthesia. The risks from sedation increase as you get older too. Now, I know what you're thinking, but what if I have symptoms, or there's a family history of colon cancer? That's a valid point. If you're having symptoms like unexplained weight loss, blood in your stool, or significant changes in your bowel habits, then a colonoscopy might be appropriate. But if you're feeling great, it's time to ask yourself, is this test really necessary for me? A major study followed over 50,000 seniors who had normal colonoscopies and found no improvement in colon cancer death rates among those who continued screening. However, those who avoided the test had fewer complications and were hospitalized less often for procedure-related issues. It's clear that for most healthy seniors, routine colonoscopies after age 75 don't improve health outcomes, they just introduce unnecessary risks. Test 2, PSA screening for prostate cancer. Let's move on to another common test that many men over 70 are told they need, the PSA test for prostate cancer. This test is controversial because research has shown that it often leads to overdiagnosis and overtreatment of cancers that would never have caused any harm. You might be wondering, but what if I have prostate cancer? It's true that prostate cancer is common among older men. In fact, studies show that 60 to 70% of men over 70 have prostate cancer cells in their bodies, but here's the catch. Most of these cancers are so slow-growing that they don't cause any symptoms and never lead to serious problems. Many men with prostate cancer die of other causes, never knowing they had the disease. So, why do doctors keep recommending PSA tests? Well, it's easy and quick, and it leads to follow-up treatments like biopsies, surgeries, and radiation. But here's the downside, these treatments often come with serious side effects, such as incontinence and sexual dysfunction. The problem is that when a PSA test is positive, doctors often recommend a biopsy. But that biopsy carries a risk of life-threatening infection, especially in older men. And let's talk about the follow-up treatments. Once cancer is found, men are often pushed into surgery or radiation, even though the cancer might never have affected their quality of life. I've seen so many men who. What happens then? If your test shows something abnormal, you might be sent for more invasive procedures like cardiac catheterizations or stent placements. These follow-up procedures can cause serious risks, including bleeding, infection, and even stroke. And here's the kicker: studies have shown that seniors who undergo routine stress testing actually don't have better heart health outcomes than those who don't. In fact, they often end up with more complications from follow-up procedures that weren't needed in the first place. One study, published in the Journal of the American Medical Association Cardiology, followed 10,000 seniors without cardiac symptoms. It found that those who had routine stress testing didn't have better cardiac outcomes, but they did experience higher rates of complications from follow-up procedures like stents and bypass surgeries. These procedures may not have improved their health at all, but they put them at greater risk. The takeaway here is simple: if you're not having any symptoms, there's no need to get a stress test. If you're feeling fine, the best way to keep your heart healthy is through regular exercise, a healthy diet, and managing known risk factors like blood pressure and cholesterol. Stress testing should only be done if you're experiencing symptoms, not just as a routine checkup. Test 4: Routine mammograms for women over 75. Now, let's talk about another test that many women are told they need as they age: mammograms. While breast cancer screenings have been a standard part of women's healthcare for years, recent studies are showing that routine mammograms for women over 75 may not be necessary, especially if you're healthy and have no symptoms. As women age, the risks and benefits of mammograms change. Breast cancer tends to grow more slowly in older women, and the likelihood of finding a dangerous cancer through routine screening diminishes significantly. For women over 75, the risks of mammograms often outweigh the benefits, particularly when there is no family history of breast cancer or noticeable symptoms. The reasons to reconsider routine mammograms include the fact that, after age 75, women are more likely to experience false positives. This means that the test could show signs of cancer when there isn't any, leading to unnecessary follow-up tests, biopsies, and treatments that could cause harm. These treatments can have serious side effects, including pain, scarring, and anxiety, all of which could impact your overall well-being. Research has found that for women with no symptoms and no family history, routine mammograms after 75 may not reduce the risk of dying from breast cancer. Instead, they may only lead to overdiagnosis and overtreatment. In fact, a large study published in the Journal of the American Medical Association found that after age 75, mammograms do not improve survival rates but increase the likelihood of undergoing unnecessary procedures. If you're a woman over 75, it's important to have a conversation with your doctor about the necessity of mammograms in your specific case. You might decide that you're comfortable with annual screenings, or you might agree that avoiding them is the right choice for your health. Test 5: Routine thyroid testing. Another test many doctors recommend, especially as we age, is routine thyroid testing. For seniors, particularly those over 70, it's important to ask whether this test is truly necessary, especially if you're not experiencing any symptoms. Thyroid problems, such as hypothyroidism, an underactive thyroid, or hyperthyroidism, an overactive thyroid, can indeed impact older adults. However, routine testing without symptoms can often lead to overdiagnosis, unnecessary treatments, and confusion. In fact, research shows that thyroid tests often produce results that might not even be significant or meaningful for seniors who aren't experiencing any symptoms related to thyroid function. The thyroid function changes naturally with age, and slight abnormalities in thyroid hormone levels are common in seniors. But these small changes often don't affect your health and might not require treatment. The real issue comes when doctors treat these slight abnormalities as serious problems, prescribing thyroid medication when it's not necessary. This can lead to side effects such as heart problems, osteoporosis, and other complications that could actually worsen your health. For example, one study published in the Journal of Clinical Endocrinology and Metabolism found that older adults who are treated with thyroid hormone replacement therapy for mild thyroid dysfunction are at higher risk of developing heart issues. Additionally, long-term use of thyroid medication can also increase the risk of bone fractures, particularly in women. Unless you're experiencing symptoms such as unexplained fatigue, weight gain, or mood changes, which might indicate thyroid problems, routine thyroid testing is generally not recommended for seniors over 70. Instead, it's better to focus on maintaining a healthy lifestyle, managing any existing health conditions, and addressing symptoms as they arise, rather than relying on routine screenings. Making informed decisions, what you can do instead. Now that we've discussed the 3 common tests that you might want to reconsider, let's talk about what you should focus on when it comes to your health as you age. The truth is, many of these aggressive screening tests aren't necessary for healthy seniors, and by avoiding them, you can actually live longer and healthier lives without unnecessary complications. But the key here is understanding what does work, what truly improves your health and quality of life. First and foremost, exercise is one of the most important things you can do for your body. Regular walking, strength training, and stretching exercises can keep your heart, muscles, bones, and joints strong, and they can improve your overall energy levels. Even just 30 minutes a day of moderate activity can make a huge difference in your health and well-being. Plus, exercise helps reduce the risk of chronic diseases like heart disease, diabetes, and arthritis. Next, let's talk about nutrition. A well-balanced diet is crucial for maintaining health as you age. The Mediterranean diet, which is rich in fruits, vegetables, whole grains, and healthy fats like olive oil, has been shown to support heart health, brain function, and overall longevity. It's a simple, natural way to keep your body running smoothly, without relying on medications or invasive procedures. Social engagement also plays a huge role in healthy aging. Staying connected with friends and family, joining social groups, or even volunteering can boost your mental and emotional health. Being socially active is linked to a lower risk of depression, cognitive decline, and other age-related issues. Finally, managing your known health conditions, like blood pressure, cholesterol, and blood sugar, through medication or lifestyle changes is key to staying healthy as you age. By focusing on these simple, evidence-based interventions, you can improve your quality of life without the need for unnecessary testing and procedures. The important takeaway here is that after age 70, less is often more. Focusing on maintaining your health through exercise, nutrition, and social engagement will do far more for your longevity than undergoing unnecessary screening tests. Be selective, be informed, and focus on what truly helps you live a better, longer life. Bonus point: have an open conversation with your doctor. One of the most important steps in taking control of your health as you age is having an open, honest conversation with your doctor. Many times, doctors follow standard protocols and may recommend tests without fully considering whether those tests are necessary for you. It's essential to speak up and ask questions, ensuring that the tests or procedures being recommended align with your unique health needs and circumstances. Before agreeing to any medical test, ask your doctor these key questions. What's the real benefit of this test for me at my age? Are there risks associated with this test, and how do they compare to the benefits? If the test results are positive, what treatment options would I have? And how would those treatments impact my quality of life? What do the latest guidelines from medical organizations say about this test for someone my age? It's important to feel comfortable discussing your concerns with your healthcare provider. A good doctor will understand your need for clarity and will be willing to explain the reasons behind any recommended tests. If they aren't willing to answer your questions, it might be worth considering a second opinion. Taking the time to have these discussions can help you feel confident about your decisions, and it will ensure that you're not undergoing unnecessary tests or treatments that may pose more harm than benefit. So, what have we learned today? As we age, it's essential to take control of our health and make informed decisions about the tests and treatments we undergo. While doctors often recommend routine tests like colonoscopies, PSA screenings, and stress tests after age 70, medical evidence increasingly shows that for healthy seniors, these tests may do more harm than good. By refusing unnecessary tests, you can avoid complications, prevent overdiagnosis, and focus on interventions that actually improve your health. Regular exercise, a healthy diet, staying socially active, and managing your existing conditions, these are the things that will truly support your health as you get older. I understand that it can be difficult to question your doctor, especially when they tell you these tests are mandatory. But it's important to remember that you are the best advocate for your own health. Don't be afraid to ask questions, seek a second opinion, or even refuse a test if you feel it's not in your best interest. Your life, your health, and your well-being matter most. If you found this video helpful, please leave a comment below and let me know your thoughts. Have you ever been told you needed a test you weren't sure about? Or maybe you've made the decision to refuse a test in the past. Share your experiences with me, I'd love to hear your stories. And remember, you have the power to make informed choices about your healthcare. Take charge and focus on what will truly improve your life, not what adds unnecessary risks. Thank you for watching, and I'll see you in the next video.